You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
Pennsylvania native Camille Schrier is the reigning Miss America and is taking a break from pharmacy school to carry out the responsibilities that come with the crown. A self-described science nerd, Camille spends time with students doing experiments and talking about drug safety.
I understand you grew up in Pennsylvania and attend school and represented Virginia in the Miss America pageant. Do you still have family in Pennsylvania?
All of my family. I am the person that flew away and moved to Virginia, and then all of my family stayed here, and so I am now kind of based out of Pennsylvania this year as I do my job.
You conducted the first ever science demonstration in the talent portion of the Miss America pageant. How challenging was it to convince the organizers to do that?
So technically I was the second. So in 2015, Miss Vermont was competing for Miss America 2016. She did the first ever science demonstration. I'm the first to ever win with a science demonstration. So I can't take too much credit, but absolutely am the second person to do that I know of. I'm a science nerd at heart. I wanted to do something represented myself. I've had people say, I didn't know how I was gonna like this when I first heard that you were gonna do a science demonstration on stage, but it's really cool. And a lot of people are interested to see their children's reaction. And I care a lot about how the kids like it because that's my primary audience with this. I bring it to schools across the country, and I do these demonstrations for kids to get them excited about science. As Miss Virginia, I did a school tour where I would visit elementary schools to do drug and alcohol education for those kids. And that fit with my personal social impact initiative of Mind Your Meds, the drug safety and abuse prevention. Now I'm going into elementary schools or middle schools or high schools that are specifically interested in having me come and do science outreach. Starting in August when the school year began, I was in front of 4-year-olds in preschool trying to explain what alcohol is and what drugs are to that age level. And quite honestly, I had never interacted or communicated with children until August of 2019. So I learned on the job. I am the youngest on both sides of my family. I don't have little cousins. I didn't babysit. I didn't have those kinds of experiences. And so I'm trying to figure out how to explain what alcohol is to a 4-year-old or what drugs are. And so I kind of made this game that was inspired by this poster in my pharmacy school, which is part of why I decided on my social impact initiative. And it's a poster that says pills versus candy. And I'm like, how applicable is this to a 4-year-old? Knowing that they're going to put everything in their mouth. So we play a game where those children have to guess which one of the pictures I show them is a pill and which one is a piece of candy. And they're very similar. And not once has everyone gotten it correct. And so we talk about why it's really important to ask people what they're putting in their mouth, not picking something up off the floor, not picking something off a counter, especially in grandma and grandpa's house, where that might be the population where they're taking more medications. And so I focus a lot on the medication safety and then just the awareness of drugs are bad. They're going to hear that throughout their time. But once I get up more toward the end of elementary school age, 4th and 5th graders, they have a really good idea of what I'm talking about. And so we can have a totally different conversation. They know more. Maybe they have family members, they have older siblings, maybe who are experimenting with those types of things. But to have someone come in with a sparkly hat on their head and tell them that drugs are bad and that they're really scary for their body might be a different person telling that to them, and they're going to perceive that in a different way. It's not mom and dad, it's not their teachers, it's not their school guidance counselor, it's this cool princess lady that comes in and tells them the same thing. It might hit differently.
Your mother is a nurse. You chose to go to pharmacy school. How did those experiences influence your social impact initiative?
There is a huge gap sometimes with parents that don't have medical training to be able to keep their kids safe, or if they're caring maybe for their parent who's an older adult, these are things that sometimes they need help with. I wanted to address that, number one, but then I took a naloxone training class while I was in pharmacy school. And I was like, gosh, this is much more of a problem than I ever expected. Thankfully, I don't have a personal connection to the opioid crisis. Then I realized we're talking about prescription medication safety with kids and older adults, but a lot of opioid abuse comes from prescription drugs. And so I felt like there was a segue and that I didn't necessarily have to choose between those two pieces. And so I've just chosen to combine them. When I'm talking to a 4-year-old, hopefully they're not affected by the opioid epidemic yet. But when I'm talking to an older population or an adult population, I can talk to each of those groups with something that touches their life. And so that's part of the beauty of what I do is that it's really applicable to every single person I meet.
What are your thoughts on a connection between mental health and drug abuse prevention?
I have a lot of thoughts about mental health. And, I was just having that conversation with my mom the other day, how I feel like our healthcare system fails people with mental health disorders frequently. And we're trying to treat a problem without going to the root cause. It's funny, people assume that people in pharmacy just want to give people more medications, when in reality, we're trying to find ways many times to get people off of the medications that aren't necessary for them and finding non-pharmacological ways to treat those patients for what they're going through. And so I'm someone that's gone through mental health problems throughout my life, and medication has helped me at some points. And for some people, maybe they need to be treated in a different way, maybe with a pharmaceutical product that can help them if that's something that their doctor seems they find is necessary for them. Because people tend to end up self-medicating in those particular situations. Maybe they've gone through trauma and they are trying to find their way out of that. But in reality, they're using maybe a drug that is prescribed to them, someone else's drug that was prescribed to them. Street drugs, there's so many different ways that people are trying to cope with that pain, or really just any type of pain in their life. So I think that mental health is a huge thing that we need to destigmatize in our country. And so that's why part of my job as Miss America is to talk about that, because people have this weird perception that Miss America has never gone through any adversity and that I'm just this perfect human, which is so far from true. If I can show someone like, hey, Miss America's gone through mental health issues, it's totally fine if you have too. It might be able to help quelch that stigma that happens, which is so sad for people. And then people turn to alternative options to be able to find relief. And that's difficult because that can have a lot more influences in their life that's unintended.
Any conversations with students that have surprised you when you're talking about medicines?
I had a little boy tell me that he took all of his grandfather's blood pressure pills one time and he ended up in the hospital. He thought they were Tic Tacs. I found that out through my medication versus candy game. I immediately was like, this is why we play this game. And talking about the opioid crisis that started really heavily in Virginia, in Southwest Virginia, still an area that's really hard hit. I'll go into those schools and talk about drugs being scary and as something that can hurt you and kill you. And there's teachers that come up to me and they're like, a lot of these kids go home to parents that are addicted to heroin. That is what they see at home. It's those types of things that always shock me. You want to have kids know that drugs are bad, that medications can be scary if not taken correctly, but you don't want to scare them away from ever taking a medication again. It's very humbling, especially as someone who's going into healthcare, to realize that this is happening in their home and these young kids are dealing with it, and what are the psychological effects on those children later? How are their opportunities going to be impacted throughout their lives? It keeps you inspired to do the work that you do when you meet these kind of people throughout the time.
What do you cover when you're talking to parents?
Being open and willing to talk to your provider, whether or not it's your pediatrician or those really cool pharmacists that are behind the counter, because I didn't really understand what pharmacists did until I actually entered pharmacy school. And I realized how much information you have to learn and what an underutilized resource those people are. That if your child is sick, you don't know what to do, that those people are there to help you quite literally. Instead of trying to self-medicate or self-diagnose your child, there's a healthcare provider that is accessible and sitting there waiting to help you. Making sure that you're throwing medications away and getting rid of them. That's another huge piece of what I do, is disposal of whether or not it's opioids or just any medication that you're not using. So I've worked with the DEA doing public service announcements for drug take-back days, which happen biannually. And those are little things that parents can do, and it's important for people to understand that those are options and to throw medications away safely, but still get rid of them. More than anything, it's an awareness thing for me to be able to make parents aware that they are at risk for hurting their child with a medication. Or if you're taking an opioid medication, that you're at risk for an addiction potential. Or if you have these in your home and they're not taken care of, or they're sitting there, you're putting other people at risk.
Camille Schrier, the current Miss America, speaking with Keystone Edition's Mindy Cronk about her activities this year to raise awareness of the importance of drug safety and abuse prevention for all ages. Presented by Battling Opioids, a project of Pennsylvania Public Media.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%. And we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.